Hello, everyone. Hello, everyone. Welcome to the world of private dental practice. You may be a dental student, an intern, or a PG student, or a fresh practitioner. This session is meant for you. Dentistry is a big issue about a small tissue. Yes, of course. Having 232,813 dentists in India and 38,311 dentists even in a state like Kerala, a budding graduate will always have the doubt that how to go ahead in the profession of dentistry. What after BDS is a major question. That itself is a big continuing dental education program. But my only branch of what after BDS here, which I am going to discuss, is how to set up a successful dental practice. I'm not going to talk about the opportunities abroad in European countries or Gulf, or how to go ahead with the post-graduation, or what all course, what you can do after graduation. My only focus for next 25 minutes will be on successful dental practice setup. Here we go. Friends, once you complete your internship, you are about to start your practice. The current situation in many of the states of India is that more than 90% of dental graduate students are females. So I will tell you, better you plan your family life and future before you think about setting up your dental practice. Because if you get married, you may need to shift your place. If your husband is a dentist, well and good. If not, you will have to take more care. So step number one, decide about your future. Are you going to start the practice and continue? Are you going to get married and you are going to migrate? Or you are going to do PG or going abroad? So this is the first decision which you are supposed to take. Okay, you are an intern. Sir, I'm already married. My husband is an engineering in Dubai. I'm going to settle down at Karunagapalli, Kerala. I want to set up my practice. Take this an example. Agreed. Number one. The next step is that you have to search for a location. Yes. Do you have a building of your own? Any of your relative or friends or non-people? The first thing is that an owned building is best and better than a rented building. That is not always possible for all, I understand. So you don't have a building. This particular lady who is from Karunagapalli, Kerala, don't have an own building or a relative's building. So she has decided not to buy because no money. So to take it for rent. So decision number 1 and 2 over. Now we are moving ahead in search of finding a best place to start a dental practice. Earlier, there was a concept that all dental clinics should be in first floor or dental clinic should be in a junction. But dear friends, currently the concept no more exists. Most of the dental clinics are there now on ground floor, which attracts more geriatric patients. And rather than in junction, people are searching for area where parking facility is available. So I don't think you have to go for a main junction. You can find a little suburb area, but with good parking facility and accessibility for patients. Earlier, a clinic near a bus stop was success, but now most of the patients come in 2-wheelers or 4-wheelers. So bus stop is not that mandatory near your clinic. So we have decided that lady dentist from Karunagapalli has decided to start a practice there, to select a rented building, not in the main junction. Now the question is, how many square feet area I want? Minimum of 300 to 400 is must for a dental clinic. 800 to 1000, ideal. More than that, you can set up a posh dental practice. So to sum up, around 500 square feet area needed. It is always better if there is a hospital nearby, a medical shop nearby, a private medical practitioner nearby that can sum up or increase your dental practice. So it is better that you take a round all around the area. The particular lady took a two-wheeler and took a ride all over Karunagapalli, near and there and far and near, and to find out where all dental clinics are there, where all good residential area are there, is there any flat, is there any medical personnel practicing, which area will be scope-full. It took almost 1 week for her to find out such an apt area to start a dental practice. Step number 4 over. Now, discussion with the building owner. Friends, you know that you'll have to pay an advance amount for the building. It can be 50,000, 1 lakh or 2 lakh. According to the building, he may ask even 5 lakhs, even more than that. It is always better to offer more money as advance. You know why I'm telling this? Thereby, you can bargain for a less rent. It is always better that if you give more money as advance, because that is always a refundable deposit. So the rent will be more than its interest. So it is nice that to have a discussion with the building owner to reduce the rent by paying little more advance, if possible. And moreover, please do tell him in the first discussion meeting itself, I am a fresh practitioner. Basically, I need a minimum 1 year to stand on my own foot and minimum 3 years to get little established. And normally it takes 5 long years for me to establish as a dental practitioner. So, sir, please don't think about increasing your rent the very next year. Kindly give me 2 years or 3 years in the beginning. That is what you can say. So, dealing with the building owner already, check for the electricity connection over there. It is not mandatory that a dental clinic need 3-phase connection. This is the biggest misconception many of the practicing dentists have. It is not mandatory because it is not more than 500 watts. So, a single phase will do the job. Now, the building selected, dealing with the discussion with the building owner over. Now we are going ahead. What next? To find out a good name, to start advertising via fixing the board, purchasing the materials. Where to purchase? Find out the dental dealers nearby, search in your internet, discuss with your teachers and nearby practitioners and friends so that you'll get an idea about what all you have to purchase once you start your dental practice. Always better, ask 3 dental material shops to give a quotation for a dental clinic setup. They will give. And tell your budget, sir, I have hardly this much money. And how much money do you think a clinic setup will need? Dear dental students and interns, those who are listening to me, those who are not started a dental practice, I'm telling you, 3 lakhs rupees is enough to start a dental clinic. In 5 lakhs rupees, you can start a dental practice in above average level. I am telling right from the bottom, right? Even I have a clinic, not me, I have seen a clinic in Cochin who has spent around 40 lakhs rupees for the interior decoration. The reception area have a fountain. You know how much is the total investment? 3.5 crores, including the building, interior decoration, and all instruments. Please don't think about laser or even RVG in the first instant if you don't have money to pour. If you have money to pour, okay, well and good. Otherwise, a normal X-ray machine is fine. You can think about 1.5 lakhs generator after 6 months. So with the minimum investment, you can very well start a clinic. Dear budding dentists, please do join Indian Dental Association, the specialty organization of dental practitioners. Meet the office bearers, pay the subscription and be a member there. Go for an idea meeting, meet the dentist, go and meet all the dental practitioners who are practicing nearby. Good morning, Thomas, sir. My name is Dr. Manoj. I'm a freshly passed out dentist. I just had an experience with one of my seniors dental clinic for past 6 months. I'm going to start a dental clinic 2 kilometers from here. I just came to meet you. This is a normal courtesy what you can do. Don't forget to meet all the shop owners in your area. Meet the pharmacists in your area. Meet all the medical practitioners in your area. Meet all the leaders of residents association in your area. Meet your bank managers, firm owners, company owners, auto drivers, everyone, give them an invitation. Hello, I'm Dr. Manoj. I'm going to start a dental clinic here, there in the ground floor next to South Indian Bank. Please do refer the patients, or please do come for inauguration. Please do visit whenever you are free. My dear friends, this is the best publicity what you can give for your clinic, so that everyone will come to know that you have started a practice. So a beautifully designed invitation, a beautiful meeting and introduction to all stakeholders nearby will give a beautiful publicity for your clinic. I have started my 4th dental clinic 2 years back. You know who inaugurated it? Inaugurated by the Vyabari Vyavasai Ekopana Samiti, the Merchants Association president, and Indian Dental Association, my branch president. So I considered my profession and I considered the local community there. This is how we grew up. Go to the medical shop once in a month. Hello, Bhaiya, kaisa chal raha hai? My practice is picked up just 2 months. Okay, hardly 5 to 6 patients are coming. You just share the details with them. In COVID period, if people find it difficult to get a consultation, you please send some patients to my clinic. I can give them free consultation. Give an offer. This is how we promote ourselves. Start a Facebook page for your clinic. Fix up a notice board in your reception, whereby you will fix the certificates. Indian Association of Public Dentistry Kerala State Conference, Phoenix 2021, attended by Dr. Manoj Thomas. Fix your certificate there so that let the patient see. Dr. Manoj Thomas presented a scientific paper, Ergonomics Perspective of Left-Handed Dentists. Wonderful. Patients will analyze your capacity. So dear friends, staff pattern. Find out a receptionist and you, enough for the time being. Later you can appoint a junior also. So to start up with your practice, is there a need of television in the reception? I will tell, if you can afford, well and good. Otherwise, for books will serve the purpose. Even if a television is kept there, please don't take a cable connection. Patients are not there in the reception to watch serials and movie songs. They are here for dental treatments. Why don't you play dental videos in your reception? Put your pre and post treatment photographs. Put your own dental health talks. Download some dental health talks from YouTube video. Even if you want to play a movie or movie song, you can very well do that with the help of a USB. Copy it, pin it to the TV so that you can play. So absolutely a cable TV connection is not needed in a dental clinic. Wish the patient when they come to the clinic. Hello, good morning, I'm Dr. Manoj. And the parent, what is your name? Lilitha Chechiano. Okay, please be seated. The courtesy, the interns who are listening to me, the students who are listening to me, just ask yourself, you are taking so much of case histories, you are done so much of treatments in various departments. Have you ever introduced yourself? You may be asking the name of the patient, taking the complete history. Have you ever introduced yourself? Hello, I'm Sharanya Mohandas from Trivandrum. I'm doing my final year here. I've been studying here for past 4 years. Before doing your filling, we need to collect some data. May I ask you some questions? Friends, together with the cognitive knowledge of your brain, together with the psychomotor skills of your hand, we need to have good affective skills. The feelings, the attitude, and the communication skills. That is what gives a paka publicity for your practice. Giving a pat in the back of the patient after prescribing a medicine. Don't worry, the pain will subside. You know how much it counts? This is what the patients really appreciate and really enjoy. I bet they will tell minimum 10 people. That doctor is fantastic. He is talking to me very nicely. So friends, the 7 steps are over. You have started your dental practice. Now, are you confident to take a feedback? You must be. Prepare a feedback form. Ask some of your patients, at least the patients whom you know. Just ask them few questions. What you like the most in this dental clinic? What was the worst thing that you saw in this dental clinic? How was the receptionist? How was her interaction? How was the treatment by the doctor? That is about you, but the feedback is given from the reception. How was the ambience in the clinic? Was the treatment comfortable? This is how we are going to improve our own skills in the dental practice. You are a BDS graduate, you don't know how to do an access opening. So sad. Go, learn it. You are very poor in extracting a strong molar teeth. Go, learn it. You are not good with various procedures of pulpotomy. Go, learn it. We have so much of continuing dental education programs and hands-on programs going on. Have you ever typed in Google how to do a difficult extraction? If not, it is our mistake, right? So much of videos which will give you tips and tricks. I still remember when I started practice, when I start crown preparation, I will check whether 2 millimeter is reduced before taking impression. So I thought how to measure this 2 millimeter. I kept a burr and I measured that burr in the scale, then understood it is only 0.5 millimeter. Then I thought, okay, 4 burr, 2 millimeter. I was finding it very difficult to measure 2 millimeter, which will give me an idea, a clue about the space which is reduced from the crown. Later, when I attended a program, I came to know that a simple wax sheet, if kept above the prepared tooth, will give you an idea whether it is 2 millimeter or not. So there are so much of tips and tricks. Do you know that a tea bag can control bleeding? Do you know that a diluted tincture benzoin, ₹7 from medical shop can control bleeding? Do you know that a tetracycline capsule powder opened and put in a socket of extraction can reduce the risk of dry socket? Do you know that a female patient's in menstrual cycle should not be attempted with a disimpaction? We learn so much of things in theory textbook, but we seldom follow that. Friends, this is just a gist about setting up your dental practice. We'll meet soon in various platforms to know more about how to go ahead with the successful dental practice. In this few minutes, hope I have enlightened the thought process in you, which will ultimately result in a thinking and a productive capacity of yourself, the new budding dentist. Wish you all good luck. Thank you. Thank you very much.